And so we became friends, and we began talking every day on the phone. I was working at a clinic in the Bronx, and he was working in a clinic in Staten Island, and we spoke 6 or 7 times a day. And then I said to him, listen, there's something I have to tell you. And you can't tell anyone. But, you know, the reason that I gave up medicine and went to drama school in London, and then why I came to live in New York, I'm HIV positive. And you can't tell anyone.
Paul, I'm telling you, you have to tell your story.
So it was unthinkable to me that I could even tell my story. And after many arguments, I decided that I would. And I said, but no one's going to be interested.
I'm coming with you. And I'm going to be there. I'm interested.
So we went to Philadelphia. It was 1994. And I gave a paper at the American Psychiatric Association conference called The HIV-Infected Psychiatrist, Clinical Issues. Ladies and gentlemen of the APA, my fellow psychiatrists, I'd like to tell you a story. When I was in my final year of psychiatric training, one afternoon, a patient of mine came into my office, sat down, and said, so, Dr. Browde, how are your T cells? And I said, what? And she said, yes, I know you're HIV positive. I looked your results up on the computer where I work. And I said, how do you know it's me? And she said, isn't your middle name Eric? And for weeks and weeks, she came back and asked me how it felt knowing I was going to die, or whether I would get kicked out of the program if she told my supervisors. You see, I told no one that I was HIV positive. When I was interviewed for residency training, the director said, oh, you're gay, Paul. That's very interesting. You're not HIV positive, are you? And I said, no. And he said, good, because we've lost some residents to AIDS. It's been very disruptive to our program. And I kept it a secret when I worked on an AIDS unit for the first 6 months of my residency, even though people were dying of shame right next to me. One of my patients, I sat and ate White Castle hamburgers with him when he spoke about the shame of dying of AIDS, and I said nothing. And I kept it a secret, though I was vomiting in the every garbage can I could find from the side effects of AZT. And I kept it a secret on a ward round when an American doctor presented an AIDS patient using an American medical term that I'd never heard in South Africa. This is a 28-year-old SPOZ. It stood for subhuman piece of shit. So ladies and gentlemen of the APA, I'm here today to tell you that when we talk about our AIDS patients the way that we do, behind closed doors, it hurts them. And how I know that? I am them.
Take a moment.
Yeah.
Take a moment, because that story's a powerful story, and it's still the same you.
Mm.
So, this is essentially the story that Paul and I have been telling for the past 15 years. It started at the AFTA, American Family Therapy Association conference in 1996, 8? Something like that.
Yeah.
And for 6 people. And then 2 years later, we were keynote speakers at the Narativ Therapy Conference in Adelaide, Australia, for 400 people. And so it has gone on. And what we found was that people would come to us after we told out the story, and they'd want to tell us their stories. And we realized that we had to create some kind of format in which people could tell their stories, because there were so many stories, there are so many stories to be told, that were being triggered by the story that we told.
We're a human rights organization. We use media, pop culture, and community mobilization to really inspire people to become agents of change themselves. And that does involve telling their own stories. It involves sharing their experiences with other people and sort of carrying on that. But we use arts, media, and pop culture for our work. I'm going to talk a little bit about what we call our theory of change. I personally have found it very useful even when I do my personal work. And this is actually our logo, so we're really excited that we've figured a way to fit our theory of change into our domino logo. But basically, we have a 5-pronged strategy where we create dialogue through storytelling, by using technology and culture tools to challenge norms and make human rights relevant to people's lives. So human rights is sort of this overarching framework that people don't necessarily connect to. So by using storytelling, we really try to bring human rights home into people's individual lives and have them relate to issues. This is a campaign that we launched in India many years ago, and we've just gone global with it. In Hindi, it's called Bell Bajao, which means ring the bell. And the idea was to get men and boys to take a stand and interrupt violence. So kind of pulling men away from the idea of being perpetrators of violence and, really saying that, like, there are a lot of guys out there who want to do something but feel like they're excluded from the narrative. And so the idea was ringing the bell is like a metaphor, but in India, when it started, it was like, if you hear violence in your community, you can ring the bell and stop that violence. So we did a series of ad campaigns in partnership with a big ad company in India that donated their time to us, which was amazing. And the government also helped us kind of get the ads on all these different, on all these television channels. And with that, we did a lot of community mobilization work where we go into villages, show these ads, do kind of trainings, human rights trainings on gender and sexuality and violence. And we use puppet theater in this case. So I just want to show this last video. It shows some of our, what we call rights advocates in India. So there are people in these towns and villages who get trained, and then they actually kind of are volunteers for Breakthrough after that and go on and train other people, which we've trained about, I think, 75,000 people in the last 5 years in this way, and it's really been a great, so I'm just gonna end with this last video. Oh, this is the ad now, which is.
What do you think of yourself? झूठ बोलने की आदत पड़ गई है तुमको, just because I don't say anything. तुमको बस एक ही भाषा समझ में आती है, लेकिन एक और बार मेरे साथ हुआ ना तुम्हें। एक फोन कर सकता हूँ? हेलो जी, हाँ, मैंने ही फोन किया। Bring domestic violence to a halt. Ring the bell.
So yeah, we've just taken that campaign global in 7 countries around the world with partners, and the initiative that we've launched is called 1 Million Men, 1 Million Promises, and the idea is to get men to take kind of these very concrete, actionable promises, even if it's like, I promise to teach my son about sort of, I don't know, to dignity and respect for everybody, like those kinds of things. And so the idea is really to get men involved in the movement to end violence against women.